I'm Dr. Paulina. I'm a GP and aesthetics doctor. Recently, I've had a lot of patients ask me how to wash hands correctly, and also I could see them watch me at work, so I thought I'll make this video for you to show it to you. So the most important thing is what in NHS we call bare below the elbow. So that means that we keep our nails short and ideally no nail varnish on, because that can be a great spot for bacteria to live on under our nails or in cracks of nail varnish, and also not to wear any jewellery, watches, and ideally have a short sleeve to wash our hands properly. So we'll begin by turning the tap on. So that's actually a good tip to prevent contact dermatitis and eczema, which is a common healthcare acquired issue, but also hairdressers can suffer from it, and anybody who washes their hands frequently. So we apply foam, so I have sensitive hand wash foam, but you can use obviously any soap, to your palms, and you rub it together like so. Then you clean the back of your hands and between your finger webs. So this is one of the most commonly missed areas, and I will show you a picture of other areas in the description of the video. Then you do tips of your fingers like that, and then you do your thumbs, then you just clean the palms in circular motion, and finally you do your wrists. So there's a tip that you can take from the surgeons, and they actually clean their hands all the way down to the elbows. And also when they rinse their hands, they rinse it from tips of their fingers down to their elbows, because we assume the tips of our fingers is what's meant to be the cleanest area. And they also tend to do the wash twice. So the first one will go all the way to the elbows, and the second one will just be a quick recap. So palms, back of our hands and fingers. You can do the front as well. Tips of our fingers, thumbs, and the wrists, and rinse it off. Yeah, so contact dermatitis eczema is basically when you take off the top layer of your skin off, which is the protective layer, with frequent hand washing. So it's always good to make sure you dry your hands properly, and after you wash your hands to apply a moisturiser if you want to. Make sure you don't touch the nozzle so it is nice and clean. So then if you're at home and or have a turn off tap, you can turn the tap off with the hand towel, not to contaminate your hands again. Otherwise you can turn it off with the back of your hand, or in healthcare we do it with the elbow. So then single-use towels are the best for clean hands. So we always dry it from the top of our hand to our elbow, and then dispose in a pedal bin or in a basket. And the same with this one, and again that's preventing the sensitivity. Okay, so now these are nice and clean and dry, so I could apply a moisturiser now if I wanted to. So hopefully you found it useful. I'll have another video about hand gel and also how to put on and take off a surgical mask, which you may find helpful. So share it with your friends, and stay home and stay safe. Bye.